Good morning, dear students. From today onwards, I'll be taking some classes on Squint, the topic which is not difficult to understand, but we feel it is difficult, that's all. So one of the simplest, easiest chapters in the ophthalmology. So naturally, you can easily understand if you follow properly. Today, I already told you I'm going to start about Squint only. For another 10 classes or 8 to 10 classes, we'll be talking only about the Squint. Okay. Now you can see now here. Squint, otherwise called as strabismus. The reason may be of different types, maybe a sensory problem, or a motor problem, or mechanical restriction problems. There will be so many causes for the squint, but I will tell you in detail about the squint in my further classes. Now you see now here, there are two patients. See now here in the left eye, divided inwards, whereas in the other picture, you see now in the other picture, the left eye is divided outwards. That means you know that a patient has got deviation of eyes by seeing that itself. Seeing the patient itself, you can tell is that means the patient has got squint. Now, before understanding detail about the squint, I would like to tell you something about, the axis. Various axes described in the eye. Imagine this is the eyeball. This is iris, and this is a lens. And just remember one thing, a line connecting all the central points of the eye, okay, of the media. It is called optical axis, optical or anatomical axis. Whereas now we have got a nodal point. The nodal point is in the posterior part of the lens. What is nodal point? A light ray passing through the nodal point goes straight. There is no refraction taking place in that area. The rays can go straight. That is called nodal point. It is similar to your optical center of the lens, normal lens. What you are using, concave, convex lens, it's called optical center. A light ray passing through optical center, there is no deviation. Similarly, the nodal point also, there is no deviation. Now, this is called optical axis or anatomical axis. Optical or anatomical axis. Now, imagine it's an object. And here is a fovea. Okay. Now, I'll tell you an important point. The optical center is connecting the center points of the media, need not touch your fovea. The fovea is slightly out, or it's not in the optical axis. That means what is now fovea here? An object. From the object, a ray is passing through the nodal point to the fovea. That is called visual axis. Visual axis. Visual axis what now? The line connecting the object, passing through the nodal point and touching your fovea. That is called visual axis. What is optical axis now? I told you the line joining all the center points. Here, one important point, I told you it doesn't touch your fovea. Similarly, in the pupil, the optical axis need not pass through the center of the pupil because the pupil is like that. It's not centrally placed. So slightly deviated. That's why the optical axis does not pass through your center of pupil. These two important points, never forget. It is not from fovea. It is not touching the center of the pupil. Whereas visual axis, I told you, the line connecting the object passing through nodal point goes to my fovea. This is called visual axis. Now, one more point you're supposed to know. The center of rotation of the eyeball. Imagine my eyeball length is 24 millimeter, average 24 millimeter axial length. At 12 millimeter, this is called center, 12 millimeter area. It's called center of rotation of the eyeball. Now, imagine now here, an object from the object, a line can go through my center of rotation. That is called fixation axis. Called fixation axis. Fixation axis. That means what? I have told you now 3 axes. One is what? Optical axis. One is called visual axis. One is called fixation axis. What is fixation axis? The line connecting the object of interest to the center of rotation. What is visual axis? The line connecting the object of interest to the fovea passing through nodal point. What is optical axis? The line passing through the center of media. It's not from only from posterior pole only, backside only, but not coming from fovea. These are the important points, never forget. Imagine now here, one by one. See now here you see now the optical axis and the visual axis at the nodal point. An angle is created. Angle is created at the nodal point. The angle is created between the visual axis and the optical axis at the nodal point. That is called alpha angle. That is called alpha angle. Imagine another thing. This center of rotation is the optical axis only. It's telling this optical axis. It is in the center of the optic axis now. Now the line connect or the fixation axis meeting the center of rotation makes an angle with the optical axis here. That means what? The angle between the optical axis and the fixation axis called gamma. It's called gamma angle. It's called gamma angle. Never forget now. This gamma angle and alpha angle nobody can measure. It's very difficult. Whereas what you can see, I'll tell you now. Imagine another thing. I already told you the optical axis is not passing to center of pupil. That means what? You get another axis. Another axis from the center of the pupil anteriorly draw a line. That is called pupillary axis or pupillary line. So from the pupil center, you draw a line anteriorly, cutting the center of cornea. Now just know this. Imagination is cutting the center of cornea. Whereas this is called pupillary line or pupillary axis. Now imagine now here, the visual axis and the pupillary axis and the pupillary area creating angle called kappa. Kappa angle. Kappa angle. Just know this. Are you understand now? So far I have told you what now. I have described about the axis, optical axis, otherwise called anatomical axis. I told you about the visual axis, and I told you about the fixation axis. I told you about the pupillary plane or a pupillary line or a pupillary axis. I told about the angle of alpha between the visual axis and the optical axis at the nodal point. What is angle gamma? Between the fixation axis and the optical axis at the center of rotation. The angle between the pupillary line or the pupillary axis and the visual axis called kappa angle. These are some more important points you are supposed to know before understanding your squint. I told you, optical axis what? Line passing through center of the cornea, lens and meets retina on the nasal side. Visual axis, line joining fixation point. Not I told you. Fixation axis, I told you. Fixation axis is what? Line joining fixation point at the center of rotation. These are the axes which I have described. Now we see now here. Now, I told you what is visual axis. What the beauty can now, imagine now right eye has got a visual axis. The left eye has got a visual axis. Both the visual axis should have some equilibrium. Some relationship, physiological relationship should be there. If it is maintained, it's okay. It has to be maintained. The visual axis, the relationship between two eyes should be maintained in all moments, and parallelism is maintained, except of course convergence and divergence. Doesn't matter. But usually they should obey some physiological relationship. If that is getting altered, imagine now right eye is looking somewhere, left eye is looking somewhere. It's a squint. That is what squint. The strabismus, what now? Strabismus means misalignment or malalignment of visual axis between two eyes. That can happen how? It can be due to so many factors. That means the impulse reaching from eye to brain, that's called sensory problem, maybe there. Or my eyes are moving, motor problem, maybe there. Or even when the movement is there, some restriction problem is there, mechanical restrictions. These are the various types of problems, various conditions which can give rise to squint or the strabismus in the patient. I told you what is squint, okay? Otherwise called as crooked eye. What do you mean by crooked? Here the same thing, definition. Visual axis of the two eyes do not meet at the point of regard. That means the object, they are not reaching one visual axis reaching the object, another visual axis reaching some other area. That is called squint. This is what I have already told you about the various axes. Optical axis, now the visual axis at the nodal point, you see this is called alpha angle. Now center of rotation here, and you see the line here, fixation axis. Fixation axis angle is called gamma and cannot be measured. Okay, angle alpha I already told you, gamma I told you. Angle kappa, what's the angle I told you? Kappa angle is what? Between the visual axis and the pupillary line. But you take it taken as point in the center of cornea. If the point is center of cornea, you take it as center of pupil, that's all. So okay, that's what. Just know this, center of pupil, pupillary line or pupillary axis. Can you see now? This is called the pupillary axis and the visual axis here. The angle kappa is here. That's all. Just know the point. This is the one other important point for you. Now, here one important point is what now? This kappa angle, imagine now in this case, see now the visual axis, this imagine this is what? The temporal side of the eye, temporal, that means left temporal side, outside, nasal towards the nose side. Now we have got the pupillary axis, this is the pupillary axis. Can you see this is the pupillary axis? This is the pupillary axis, this white, no? Whereas the visual axis here, if you see center of pupil, here is the center of pupil. What will happen now? In this pupillary axis here, the visual axis coming from the object appears to cut the or meet the pupillary axis from temporal side. See now the visual axis coming from temporal side. This is what is temporal side. So temporal side. What is the meaning here? In this case, if it's so, what will happen now? The pupillary axis only are going to see. The center of cornea only are going to mention. The center of the pupil only are going to see. That means what here, the center of eye, center of the pupil is slightly nasal, deviated inverse. It appears to be deviated inverse. Whereas, imagine another case, partial kappa. See now here, partial kappa is what now here? See now the visual axis. This is the visual axis. This is the pupillary axis. Now the visual axis is cutting the pupillary axis. Nasal side, this is a nasal side, that means what? Imagine now, this is a pupillary line, so naturally it appears to be slightly outwards. The eyeball appears to be outside. That means divergent. Negative angle kappa, I told you, the eyeball is slightly inverse. Because the visual axis here and the pupillary axis here, so eyeball appears to be inside. That means what do you mean by that? When you have a positive kappa, eyeball slightly outwards, it appears to have an apparent. Never forget, it's an apparent, it's not a real one. Apparent divergent squint. Apparent is not a real one. Please don't get confused. It's an apparent squint. It's not real. Now, for whom the positive kappa can occur? For whom, which patients you can have positive kappa? Normal. Normal persons can have positive kappa. Whereas hypermetropes can have positive angle kappa. That means what do you mean by that? If you see a normal person, or if you see a hypermetropic fellow, what will happen now? They will have positive kappa. What do you mean by that? When you see the person, it may look like apparent divergent. Whereas negative kappa, when you see a person, normally can be seen in which patient now? Myopic patients. Negative kappa, that means what? The visual axis appears to cut the pupillary axis from the temporal side. That means what? Appears to have an apparent convergent squint. But please remember, it's not apparent, not a real one. Don't get confused. It's an apparent only. Don't get confused. Now, I told you, positive kappa occur in whom? Normal person, hypermetrop. Negative angle kappa can occur where? Myopia. These are three important points you are supposed to know. You know what? Why you know? I'll tell you. Normally, you take, for example, hypermetrops. Hypermetropes, normally what happens now? This person, he cannot see distance. He cannot see near also, unless he accommodates. See, a normal person, accommodation coming into play only when he see near. That means he has to converge. Whereas a normal person accommodates only for near. Whereas here you see a person with hypermetropia accommodates even for distance. That means, what do you mean by that? The patient gets up from bed, he cannot see anything clearly. He has to bring his accommodation. He has to bring his accommodation to see distance also. That's why, normal part and parcel of accommodation is what? Part and parcel of accommodation, the movements. Now convergence, and the pupil is small. Normally, that hypermetropic hypermetropic patients' eye, pupil will be smaller in size. Myopic patients, pupil will be larger in size. Whereas in this case, what now? He's accommodating means convergence also coming into play in hypermetropia. When the convergence coming into play, keeps on converging daily throughout the day, he may land up, not necessarily, he may land up in convergent squint. That is what the real squint. It's a real convergent squint. So now in this case, what now? I told you, positive kappa is there, eyeball appears to be slightly out, apparent divergent squint. But real squint is what? Hypermetropy. If at all it develops. If at all it develops a squint in hypermetropy, it is convergent squint. Whereas apparently what? Not a developed squint, apparent divergent. Always remember, real squint is always opposite to apparent. Now, myopia patient, apparent convergent squint. If at all it develops a squint, it is divergent squint. Never forget this. Always apparent is opposite to your real squint. This is the important point you are supposed to know. There are so many reasons for apparent squints. There are so many reasons for apparent squint. One of the reasons is what? Normal person, problems, or an hypermetropia, myopia. These are all apparent because of angle kappa. Angle kappa, that's why apparent. You know why? If you see he's having appears to have a spin, but when you examine him properly, nothing will be there. Nothing, that's called apparent. When a real means what he's having some problem, that's all the meaning. Okay. This is what so far I have told you about the axis, and I told you about the different angles, alpha, gamma. I told you kappa angles and all. The only thing which can be measured is kappa angle. The kappa angle only can be measured in all patients, whereas gamma, alpha, you cannot measure. Then I told you about the apparent squints, classical things you are supposed to know, their basics. Then in next class, I will tell you something about other parts of squint. Thank you very much. Best wishes. Thank you very much.